Hi, my name is Kara Hardy, and today we're going to talk about Erb's palsy. Okay, you might be wondering what Erb's palsy is, and it is a condition caused by injury to the brachial plexus. And the brachial plexus is a network of nerves that control movement and sensation in the shoulder, arm, and hand. It primarily affects the upper part of the brachial plexus, which includes the C5 and C6 nerves. It sometimes will include that C7 nerve. That's less common, but it does happen sometimes. And this just leads to weakness or being paralyzed in the affected arm. So here I just kind of added a diagram so you could see how that looks visually. So right here, your nerves that are going to be affected are going to be right here. And again, that's your C5 and your C6 nerves. Sometimes that's C7 nerve, but you're just going to be more elevated to that side where the nerves are affected. And then the biggest symptom, and again, I'll talk about this more into the slides, but you're going to have that waiter's tip deformity to the affected wrist of the opposite side. So anyways, I just thought that did a good job at visually showing that. So for structures involved, again, it's going to be your brachial plexus, which is going to be a big one. Again, that's just the network of nerves originating from the spinal cord, which is your C5 and your C6, sometimes affects that C7, and that just controls movement and sensation in the shoulder, arm, and hand. Here I just kind of added a diagram so we could see that that's your brachial plexus. Those are your C5, C6, C7 nerves right there. Just kind of shows the basic view of it. So for muscles involved, you're going to have your deltoid, your bicep brachii, your brachialis, your supraspinatus, and your infraspinatus. So your deltoid is just going to be responsible for arm abduction. Your biceps brachii is going to help in elbow flexion and forearm supination. Your brachialis aids in elbow flexion. Your supraspinatus and your infraspinatus stabilizes the shoulder and aids in arm movement. So here, and again, we'll talk about this more when we get going, but it just occurs at birth. So infants. So here I thought I did good at highlighting what nerves are affected, so we can kind of see that. So yes. For signs and symptoms, you're going to have weakness or being paralyzed in the affected arm. You're going to have loss of sensation in the shoulder and arm. You're going to have a waiter's tip posture, which is when your arm hangs to the side, internally rotated and wrist flexed. I showed that on the first diagram. And then we have decreased reflexes, particularly in the biceps, and then muscle atrophy in severe cases. Here I just have an infant because that's where it occurs. And then you can kind of see where he's leaning towards that side. And then here, when you get older, some people in severe cases, they have to wear neck braces or something like that because you don't want to put a lot of pressure source on that side. So then causes and risk factors. So this is a birth-related trauma that does happen at birth. And this happens because of excessive stretching of the baby's neck during delivery, difficulty or prolonged labor, which is just shoulder dystocia, which is when the shoulder gets stuck during birth. It can also happen because a large birth weight. So if you have a larger baby, it's going to be easier to get breached in there. And again, breech delivery, which is when the first birth position, and then use of forceps or vacuum extraction during delivery. Here I just added just a breached photo so we can kind of just see how that happens. You can see kind of how those nerves can get stuck on that. Coming out. So impact on occupations. So for our ADLs, we're going to have difficulty with dressing, grooming, and feeding due to limited arm movement. With play and leisure, we're going to have restriction ability to engage in sports, games, and recreational activities requiring arm coordination. For education and work, we're going to have challenges with writing, typing, lifting, or other job-related tasks. For social participation, it might lead to self-esteem issues due to visible impairment or limitations to physical activities. I also wanted to add into social participation, you might have difficulties with children leaving you out or bullying you due to that visual birth effect. So for recommended treatment and interventions, we're going to have physical therapy, occupational therapy, surgical interventions, electrical stimulation, and then parental education. So for PT, we're just gonna have range of motion exercises, strength training, and stretching. For OT, we're gonna have adaptive techniques for daily tasks, assistive devices, and sensory stimulation. For surgical interventions, we're gonna have nerve grafts or transfers in severe cases. Surgical interventions is less common, but they do that. And then electrical stimulation used to improve muscle function. That is pretty common, I believe. And then parental education, it's just gonna have guidance on positioning, handling, and exercises for infants. Obviously, if your child has this, you're gonna wanna be able to hold them differently, again, dress them a little differently. So yeah. For precautions and protection principles, we have avoid excessive stretching, prevent further nerve damage by limiting excessive pulling or strain on the affected arm. Again, this will lead into how you dress your infant. Proper positioning, maintain optimal arm positioning to prevent contractures. They, again, when they're younger, they do also have those braces that go on them as well. And then monitor sensory changes, watch for loss of sensation to prevent injury due to lack of pain perception. Again, if you can't feel that arm and your infant can't feel the arm, then they verbally can't tell you that it's in pain because they can't feel that. So you just don't want to continuously stretch on that and make it worse. And again, that leads into how you dress your infant, how you carry your infant, and all of that. And then early intervention, timely therapy and interventions improve outcomes significantly. And that's just where kind of give you those options. So this is how you're going to have to dress your child. This is how you might have to feed them. Again, with OT and PT, along with giving you those exercises that you can do with your child at home on your own time. And then these are just the sources that I used for the project in PowerPoint. Thank you.